Hello, everyone. My name is Denise Cordero, and I'm a holistic life coach. You're tuning into Diving Deep with Denise. And this is an invitation to a beautiful sisterhood and community by women for women, where we get to have raw and authentic conversations about all expressions of what it is to be embodied as a woman. We share our pain, our suffering, our journey to healing, and our triumphs. So for today, I have a special invite, Elizabeth Gomez. She is
Hi.
a dear friend who I met actually very recently. We work at the same place together. She's a nurse practitioner. We are at a continuing care retirement community locally here in the North Shore. And I think that we found that we hit it off so quickly because almost like kindred spirits, right?
I
Uh,
agree. I've never met someone like you, Denise, and it's been refreshing. I said, there's more of us out there. It's kind of,
yes,
I'm
yes.
glad I sisterhood.
Thank you. Well, I want to give you a proper introduction. Elizabeth Gomez is a family nurse practitioner in occupational medicine at a continuing care retirement community. She has also been a provider at a busy community health center in an urban city, primarily working with underserved families as their primary care provider. She earned both her Bachelor and Master of Science in Nursing degrees from the MGH Institute of Health Professions and is a board certified nurse, family nurse practitioner by the American Nursing Credentialing Center. Elizabeth was inspired to become a nurse practitioner after witnessing their influence on the care of the patients at the MGH Center for Women's Cancer, while she worked to manage their clinical trials program. Desiring to mirror that immediate impact the role of a nurse practitioner played in the health team, Elizabeth was motivated to attend nurse practitioner school and was able to do so after being awarded the Knowles Fellows Scholarship provided to support the culturally underrepresented in the health professions. Elizabeth thrives in a diverse environment and has a passion for working with low income and strongly believes in social justice and healthcare equality for all. She enjoys helping her patients in the community with diabetes and believes that her cultural competence allows her to connect with families on a therapeutic level to educate and treat their disease. She is a devoted wife to her loving husband of over 6 years and a mother to a very active, sweet, and funny 2-year-old boy who is the absolute light of her life. Thank you for all of that.
Thank you.
I was trying not to stumble any of my words. It's definitely a lot, and it's so proud. Um, proud for me as a Latina woman to be able to um, introduce somebody that has such a background, that has so much passion for really serving our community. And not only that, that has really gone probably against the grain, the beliefs or the thoughts of, what your family wanted for you, where you created your own path um, to be a healthcare provider and to serve our community. So thank you for that. I mean, in these times right now, we owe you such a debt of gratitude for putting yourself at risk every single day to care for the people that you do, um, especially with having a young family and being a mother. I can't, and I think we've talked about this, like what goes in our minds every single day when we're like, okay, I have to go into community and there's a possibility of COVID, and I could, as much as you don on all your personal protective equipment and so forth, there is a risk there.
Definitely. It's definitely always there. These are definitely interesting times. You definitely don't go into nursing or into medicine thinking that these things are going to happen, but you know they're a possibility. We always talk about them at orientations for new jobs, and when you're hiring new people, it's something that's in the back of your mind, but you never think it's actually going to happen. And here we are. And I'd like to say we've handled it really well, but for the most part, it's very stressful. It's very, very stressful to live, for all of us, I think, to live in a pandemic, but we're doing it. We're here. We're going to get there.
Yes, thank you. Well, some of the, beautiful conversations, just turning the page a little bit about being woman and being a woman and being Latina, and some of the conversations that I think that we've engaged in that have been so heart-filling and warming for me is understanding our journey and understanding our path. And for many of us, we have, we either have a good picture of what it is to be a first generation American from immigrant parents, and just a very clear understanding of our background, our ethnicity, our culture. And for others is quite nebulous. For example, for me, growing up with my parents, both my parents came to the United States very young, and their vision for my brother and I was that we assimilate to American culture. And so we spoke English in our house, our household. There was obviously some Spanish because my great grandparents were here, my grandparents. So I grew up with, a couple of generations of families. And they, my grandmother, my great grandmother, they never learned English. And so they always spoke to me Spanish, and I was exposed to that. And obviously I was exposed to a lot of what it was to be Dominican or what it was to be Latina and stuff like that. But it was so little, because my primary household was all about, you are American. Like, this is now your born right to be American, and you have the same rights as all Americans. And to assimilate into this culture will mean that it puts you less at risk of being discriminated against. And so, and as we're hearing about all these, the racism and the social injustices and the Black Lives Matters, and we're also part of that movement and part of that group as BIPOC, right? As part of the BIPOC community. Tell me, just, can you share with, I know that you've told me before, but sharing with our sisterhood and just sharing with our community your experience of, what was it growing up for you, and how did you define being Latina?
I think that this is so funny that I was just talking about this recently. And I think that growing up Latina for me means something completely different than yourself, someone like yourself or anybody else. Because Latin culture is just so diverse. I mean, Latinas are from all over. They're from Central America, South America. They're from everywhere. Very different than being from someone who's from Europe, from Spain, from Europe. And I think just to be distinct from that even, and to subspecialize that even more, growing up in a Dominican household even is totally different than growing up Latina, right? I feel like what you are inside of your home is your own little bubble kind of thing. And that's totally different from everyone else's bubble. But then something just happens when you walk out of your home and you're out there for everybody to see, or when you meet people and they ask you, where are you from? And, where is your family from? And that's a totally different conversation. So for me, I always felt like there was just these two people. I was Dominican at home because that's how I grew up. My parents came here. My stepdad came here in the late in the early 60s. And my mother came here. So my dad came here when he was very, very young to the States, and he grew up in, very Dominican, very, didn't speak English for a very long time. My mother came here when she was in her very late 20s, and she grew up very, very much Dominican and brought all of that home. We Dominican food, listened to Dominican music. We had to speak Spanish at home. There was all of that. And, we brought those lunches to school, and people would look at me and say, what's that? I don't even know. What is that word? What's that mean? All these things that, I love about being Dominican, the food, the breakfast, the time that I would spend with my grandmother in the morning having café con leche or café con pan, all these things. But then something just happens when you walk outside of your house, and it's like the bank teller at the window. You never see the bank teller outside of the bank window. You just picture her going everywhere with her little bank window. She's a totally different person when she goes home. But when I was in school, people would ask me where I was from and be so shocked when I'd tell them that, my parents are from this heritage. And it was almost a balancing act, because I had to I was one of maybe 3 children in elementary school that were from a Latina background, even though I grew up in a very urban area. I actually grew up in the area where I practice medicine, and it's largely Central American, Dominicans, African Americans, very small white population. But I went to the one school where there was very little people of color. And I happened to be what is called, now I understand, because I didn't understand it growing up, but now I understand that I'm a white Latina, which is very, very rare, but it just means that my skin color to other people, when they see me, they think and assume I'm something that once they find out who I am, it's not what I am, because I didn't grow up white. I grew up where there was a lot of white people around me, and I grew up learning a lot about the white culture, because that's what happens in schools and when I meet people and make friends. And my best friend growing up, in elementary school, was this very pale, redheaded, blue-eyed girl that she was my only friend. And that's, I think, because most of the time, I don't think people really understood me. And I think that's my message, is that I wish people would understand that culture is a part of who you are. And when you meet someone, whatever color their skin is, try to meet them for the person that they are, because everybody's got their own story and their own experience that make them who they are. And that's a really big lesson that I really want to teach my son, because I definitely heard things that were a little hurtful, that hurt my feelings growing up, because of where I told people I was from. Because I'll tell you right now, people, when I met them, I went to a pretty affluent school for high school as well as for grad school. When I would tell people, where I came from, where my parents were from, where I lived, they had immediate judgments that they probably perceived me as to be something completely different than what I actually told them where I was from. Like, I would meet people, and then over time, in grad school or in high school, they thought I was a totally different person, a person that was probably white, lived in probably a European or a white family, and that I probably lived in a nice house in a nice neighborhood. But in reality, I was Elizabeth Salas, and my parents were from the Dominican Republic, and I spoke Spanish when I got home. I ate rice and beans when I got there, and I lived in Lynn, which is a very hard community to live in. Very, very hard. So those two things I've always conflicted by growing up. And I learned to kind of manage or kind of tell people certain things. And I was kind of cautious about who I told what, specifically, because I did know that people do judge you based on those things. And it's unfortunate. And I think that should be different for sure.
Super hard. I know for me, I grew up in New York City and Washington Heights, and I'd like to think that because growing up in New York, I mean, New York City itself is so diverse. People really didn't see color. They didn't see ethnicity. They didn't see any of these things. I mean, you could be Black, white, Asian, Middle Eastern, gay, drag, you know, and it is part of the landscape of New
Right.
York City. To be honest with you, it wasn't, you know, so for me, really assimilating into this white culture and acting as, and I didn't even see it as white. It was just being American, whatever that was.
Exactly.
But it wasn't until I actually moved here to Massachusetts a little over 20, 21, 22 years ago that I began to really notice that something is different, that people care where I'm from, because I was never asked, where are you from? Or what are you? And I was just shocked, and I just almost insulted with the question, like, what do you mean, what am I?
Yeah.
I'm like, they're like, oh, like, where are you from? And I'm like, well, I'm originally from New York City. And even to my dismay, that wasn't even what they were asking. I think the accent, of course, but it's like, are you white? Are you, I've been assumed to be Italian, Jewish, Portuguese, just about everything. And I'm like, whoa, like,
Yes.
whoa.
Yeah.
Yes, and the other thing that I noticed in my children going to school was that they were beginning to describe kids by, you know, that white girl, that Spanish girl, that Black girl. And I'm like, why are you referring to that girl by the color of her skin, or, you know, where, you know, or her background or whatever it is? And I'm like, what is her name? What is her name? And so, okay, and I'm like, okay, I've entered into a different world, and how I engage people is going to look differently. Now, going back to my first management position, I was an office manager for several years in a family practice in Lawrence, which is a predominantly Latino community. A lot of Puerto Ricans, Dominicans in that community. And I was treated differently by my position. And again, the assumption was that I was white.
Right.
And by my own people. And I felt a little bit heavy-hearted and I'm like, that they couldn't see themselves in me, that
Hear you.
they can't see that success in our people. And there are many, many, many successful Latino women and men out there, you know, and Latino men in our community. And yet in the very communities that we've worked, whether it's Lawrence or Lynn or, you know, inner cities or Salem or thing in the North Shore here, people like us that are in leadership, you know, positions or higher ranking healthcare positions. And basically, if you're not a housekeeper cleaning the floors or, you know, picking and packing in some factory, it's like this wow factor. Like you must be something else. And I think that this is such an amazing opportunity for, you know, our sisters that are out there that are Latina and can relate to this, that we are, you know, we can be successful.
Out there we have,
This is Yes, we can be successful. And we're more than just pickers and packers and housekeepers and cleaners, you
Yes.
know? And not to say that that is not a, you know, that they shouldn't be proud of their hard work and that labor, because that labor is also needed, right?
Right.
That labor is also needed and is so important. But that they have a different path if they choose to.
Right. And not to be labeled as a
Yeah.
certain person because of the color of your skin, or, that's something that I think it should be taught more, so that people understand that their children shouldn't be put in a box or they're labeled. And because it can definitely transcend generations if that's the culture that you create in your household, and that's the attitude that you have. It's definitely something that can definitely transfer to your children. I definitely felt the exact same way as you. I felt kind of a sadness, almost like I didn't fit in to my own community, because here I was at home. I identified so much with being this daughter to Dominican immigrants, and I had so much knowledge of this culture, and I brought all of that to my profession. And yes, it took a while for my own community. I mean, I grew up in this community, and I shared their culture, and I went to their schools, and came back after grad school to work here in the community to improve people's health. And I was met with a lot of, "Oh, you're very young," and people were very fearful to talk to me, even until I opened things up with, "Hi, I'm Elizabeth," and I speak Spanish to them initially, and it took me a while to get people to understand and have them learn that I speak their language and I understand their culture, and they should stop, adding adobo, and they should, kind of cut back on the sopitas and stuff like that when I'm teaching them about their culture. So it's something that's definitely helped me to understand, to help and serve my people, for sure. But definitely I went through this period of mourning and grieving until I had this rapport with people in the community that I speak Spanish, and that I'm Dominican, and this is my family, and we're from here, and things like that. And that took a while. But there was this sense of sadness. And then I almost transformed it, and I tried to make sure that I knew to tell or foster the relationship with my patients who had children that were school enough age where they could choose a path for themselves, to try and tell them, like, you can do this, you can do this, you can be in medicine. My patients that would tell me, their kids would tell me they want to be a doctor, or they want to be a pediatrician or something, I would be so excited for them, and just let them know that they have a cheerleader or a positive voice to say, you can do this. It's going to be hard, but it's good. And yeah, I just think that there's already so many odds against us. We're our own worst critic. We're even hard on ourselves, even. So if you can have more positive influences in your community, and have more people like you or I that can be in the community and say, we have a voice, we're here, and there is opportunity, and you have to look for it, but it's there, and you can get here. And I'm not saying I've made it and this is the end all be all, and this is where everybody should want to be. It's just a positive voice that I never heard, or I never heard representation in my culture. It was almost like growing up, because of my heritage and my roots, my parents had this expectation that I would, go to school for a little bit, and then I'd have a family, and, be very young and have a family very young, and things like that. But it took me a little bit longer, and not really traditional or typical of what my parents had expectations of because of our culture. So those would be my takeaways, that everyone comes with their own story. Don't judge people by the color of their skin, because everyone's, just because I'm a little bit more Americanized, it doesn't mean that, I don't have this deep understanding of what our culture is like, what being a Latina means. And it's very dear to my heart. And yeah, those would be my messages.
Thank you. That's so super, super important. Um, because I hear so many people in our community that feel or that have this perception that we are successful because somehow we came into the world with some type of privilege. And it couldn't be all the contrary. There was no privilege for us. There were a lot of challenges. And what there was very high expectations. And as a first generation American to immigrant parents, it was like, we came here to this country for a better opportunity. And that dream is going to somehow live through our kids and our kids' kids, right? Our children's children, that we're going to be sort of the hard workers and the floor scrubbers or whatever we need to do
Right.
in order to pave the way for you to have this better life and for you to have these opportunities. But it takes hard work. And it takes, even for ourselves, breaking new ground, because we really don't have, we don't have anything. We don't have any idols, or we don't have any people or a template of what it's supposed to look like for us.
Right.
And now we can do so for our children. Now we can do so for our children, but also in our community, it's like, it's hard work, and it's putting one foot in front of the other. And it is, researching and looking out. There are resources in the community. They can be hard to find. They can be hard to find, because I think that sometimes, and I don't know if you've experienced this, or at least through your own patients, in our very own communities, we have resources, but a lot of those resources kind of box us in and pigeonhole us and limit us to where we are.
Exactly.
Like, oh yes, we have help or we have resources, but where you are right now, to stay doing what you are right now, not
Yes.
dreaming or reaching for something higher and something greater and something more than you could have ever known possible.
Yes. So there definitely are, they're definitely limiting some resources for sure out there. I think that something that would be huge to help people try to get out of those boxes would be to now try to reach out to other people. And it can be hard because it's hard to find other people out there. But try your best to be open-minded and meet other people in other communities or across social media or across the country to see if there are other people like you out there to meet or to discuss what they're going through, even if it's some sort of a support for you to get through this application or this process or this hurdle or this barrier. Are you encountering this, to try and help you and to try and get over that? And I think the more we know about each other and the more we learn about how it is in other places, the more we learn about the systems that we have in place, the more we can change those policies. So the unity in that, I think what's really going to make sure that we kind of transcend and make sure that we kind of get to this place where we're all able to reach the goals that we want to achieve, for sure. But you have to get out there. You can't stay in your bubble, like you said. You can't let the resources that you have that you may need access to limit you in some of these ways. But know that it's not forever, for sure. This isn't forever. There's definitely ways out or ways to get to what you want to get to. And reaching out and having support from other people that are in the same boat as you is something that definitely helped me. But I think it would have been even better to have people that were of my culture, and understood, like, okay, how do I talk to my mom about this? Or how do I kind of get over this hump or this fight that I had with my parents, because I really want to go to grad school and they don't agree with it, or they are not being very supportive right now, because those are some things that we definitely can go through for sure.
Yeah. Thank you so much for sharing that with us.
Yeah.
So we're going to segue into what my favorite I call the deep five, so that we can begin to dive deep,
Okay.
and pun intended, into sort of your journey and who Elizabeth is.
Tell you're
uh,
gonna Denise.
so what is a life lesson that you have had to learn the hard way?
A life lesson that I had to learn the hard way. Oh my God. I think a big life lesson, a really big one, is really how to carry a relationship. Not just romantic relationship, but friendships, even, and how to make them have the longevity that you want and get out of them what you want, and knowing when something isn't healthy for you and kind of walking away from that. That was a big lesson I had to learn, because growing up, my mom didn't really have a lot of friends, and neither did my dad. My parents had they had a good relationship. It worked for them, but it wasn't something necessarily that I would want for myself. So learning that on my own was really hard. And I've had to fire some friends and that was very painful. And then I think because I had to go through those things alone, they were very painful and very personal for me. Not having the support of a parent or a sister or someone that I could kind of lean on to help me get through those times. That was a really hard lesson. And I'm talking every relationship, like professional relationships, personal friendships, and romantic and everything like that. So I think I've done okay so far. But it was hard. It has
Yeah.
been a journey.
That's a really good one. That's a really good one. And because there are some dark moments that I think that we will have to face alone, and that we will have to make decisions for ourselves. And we are not certain. We don't know. And that fear of unknown that in and of itself, I think, can bring up so much anxiety and so much worry. And I think this is one of the reasons why I'm so passionate about this work and this mission, and to have a sisterhood and to have a community. Because I've been there, you've been there, and if we don't have to face it alone, I don't want us to.
Yeah.
Yeah.
It's very helpful to not have to go through, just having a lifeline, a phone a friend, even, it's
Yes.
really helpful.
Yes. Yeah. So the next one is, what is the hardest thing you've ever had to do in your life, and how did you overcome it?
Okay. The hardest thing I had to do in my life was walk away from my family practice, which is something I grew for 4 years. It was my baby, my career. Really difficult, because of relationships I had with my coworkers in my practice and the collegiality that I had there. And I walked away from it. It was a decision that took me months, and it was very painful. And I don't think I've ever really been able to get over it. I did it because at the time, my medical director was imposing some very strict and unreasonable restrictions on like me nursing my child. So I was pumping when I came back from maternity leave. I was given a very difficult decision, and I had to basically choose between pumping for my child, who was only a few months old, and or leaving my position, basically, is what I was forced to do. And I chose to leave my position, and it was very difficult, career-wise, because I wasn't confident that I made the right decision, even though I knew it was the right decision for my family, and I had the support of my husband, and I knew in my heart that I didn't want to give up what I had already worked very hard for my son, but also I didn't want to give up what I had built over 4 years in my practice and my relationships. And that was very difficult to walk away from. But I knew that if I wasn't valued by my employer at that time for what I had brought over those 4 years, and that was the decision they were forcing me to make, that I had made the right decision. And yeah, it's very hard.
Thank you for that. I think that's so important, because what I'm hearing you say is that, you know, you value family, and career is very important to you, and it's near and dear to you, and you created these relationships with your patients, with your colleagues, and your practice. But at this time, what took front and center for you was your child and being a mother and building this new relationship with your baby. And many women are juggling family and are juggling careers, and both, you know, equally important. And, you know, there's so much out there, and we talk about this all the time, this balance of work, this work-life balance, and it almost seems like so nebulous and so out there and so esoteric, because it's like, what the hell is work life, you know, or work family life balance? Does that even exist? It exists when you create it for yourself. It exists when you are clear about what is important to you. And what I often say, and learned for myself, is a non-negotiable, right? That's when you're able to speak up, and when you're able to have those boundaries, and when you're able to honor, this is important to me and I'm not going to give this up. That is when you create that balance. It's not something that's necessarily going to be given to you. And I think many people are confused when, or we are deceived when we enter into new opportunities, career opportunities, and we hear that, well, you will have work-life balance. And I think it's so bullshit. It's so bullshit, because, you know, there will be work, and you will be, you know, you think you're going to work 8 hours, and you might end up working 9, 10, 11, 12-hour days. Right. The balance that is created, or the shift is going to happen, is when you decide, this is not for me, or this is not what I'm going to allow. There are other things that I have in my life that are important to me that I need to tend to, and I need to walk away from this situation. And sometimes that will mean, you know, that can mean your job is going to respect that and meet you halfway, or they're going to resist it, and you will have the hard decision of walking away. So
I think that's a really important point. And I also would, just to add to that, is that I think at times when we're put in these situations, like where there's a rock and a hard place, when you have your non-negotiables, it can be viewed, at least sometimes I do this to myself, that I think of it as a sign of weakness, or I think of myself as like, oh, I'm really weak. I just can't face the alternative for myself. So I have to walk away and I have to give up on something. But it doesn't have to be like that. It can be that you're actually just being strong, and that you know yourself well, and that you know what's going to make you happy at the end of the day. You can say, I think if I do this, this is what will happen, and the other path is going to take me here. Am I okay with those with either one. Which one am I less okay with, and am I not going to be able to live with myself with? And that's a really coming from a place of strength to be able to know yourself and to know your situation and to know what you're able to do. And it's not weakness. It's actually a very strong thing to put up boundaries. It's very healthy.
Absolutely. Absolutely. So, third question, what legacy do you want people to remember you for?
I know it's going to sound really cheesy, but for kindness, that's just something that I'm really a big stickler, or kind of it's a really big deal to me, is to be kind. It's something that I want to show my children, but firm, but not a pushover or being walked over, but be kind to other people, understand what other people are going through, compassion for other human life and for human beings. I mean, I guess that's really cliche, but it's, I think, one of the biggest foundations of nursing that you could ever have. If you can't have compassion or care about other life or other people, that's a huge human skill set to have for other people, but not to be walked over, and to be firm about, what you're willing and not willing to accept, for sure. But yes, kindness.
Yeah. We can never have enough kindness in the world. And for anybody that tunes into the news and tunes on to TV, it's blaring that we need more kindness, that we need.
But not. Yeah. And it's hard. There's definitely situations where it's really difficult to be kind or to even do the right thing. But then the next right thing is to be kind, if you can be anything,
So, what is your favorite motivational or inspirational quote?
Oh my gosh, I don't know if I have one. My favorite inspirational or motivational quote. I think that, and this is going to sound crazy, but my dad said stuff to me, and it's not deep. It's not like Ralph Waldo Emerson said something like this. And I think that's what I wrote in my school yearbook or something like that in my senior year, is something that was written by Ralph Waldo Emerson. I can't remember the quote right now, but something that always stuck with me. My dad, my stepdad, we had a really great relationship growing up, and I would go to him for a lot of advice, and I respected his opinion so much because he could always deal with my mother in such a good way, or at least it seemed that way. And I always admired him for that. And he was very hardworking and liked by so many people, and just a really good guy. And when I was growing up, I think I was probably in college, or just about starting college or ending college. And he used to say, "Mija, tú eres de hierro." And then I was like, oh, I said, that's what he thinks of me. And it was so honest, and it was so simple, and it was so good. And it was, just made me feel good. And it was always something that made me think, I just gotta keep going. I just gotta keep doing that, or do that. I can't lose that gumption, or that fire, I guess. And I know he meant it that way, because I know him that well, and he knows me in that way, that he meant it that way, that I had always had this little fire. I was always a fiery kid, and I was always asking questions, but I was tough. And by that, he meant that I was just really hardworking and passionate, and did whatever it took to get the job done. And I never gave up, is what he meant by that, that I didn't not finish things. I always, if I started something, I did it, and I put 100% into it. And I knew that he knew that, because, he was the person that I'd go to if I needed some help with stuff. And I was so proud to show him my final projects on stuff. And he was always so impressed. And that's like, I think, always been one of the things that I've always kept in the back of my mind. Like, yeah.
What
am I?
what I've experienced of you is totally resonates with that.
Oh, thanks.
Yeah.
Thank you.
Yeah.
I try.
So last question. What's one thing you would like to share with our sisterhood?
One thing that I'd like to share. It's going to sound really cheesy, but like that you're not alone. There's other people going through this with you. I found so much strength in finding a community of mothers or of other nurses going through the same thing as I did, in the pandemic. Just that you're not alone, and you really, if you think you are, just please look. Don't give up, because sometimes it just takes finding another person in a similar situation, or even not, just reach out and talk to somebody else if you're at a really low point, because we all get there, and sometimes we just need a hand to get out of that kind of funk. Read something that is motivational or something to you if you really can't find anybody else. Something like Dr. Seuss. It's always super motivational and maybe cheesy, but Dr. Seuss is just happy and actually really
I love Dr. Seuss.
It's amazing. He just makes you feel so great,
He does.
You're just like, I love rhyming, and I also just got a really good piece of life advice,
Yes.
It's so simple, but it's the stuff that we forget to teach ourselves and to coach ourselves with, and to heal ourselves with, to say, you're not always gonna be the best at everything. You're not always going to win the gold star, and that's okay. And you need to get yourself out of a funk if you're in one. And for me, the best way that I've been able to do that throughout my life is to phone a friend, get a lifeline, and call my friends up, and it just immediately boosts my mood. It gives me a different perspective. And it really helps. The loneliness, for sure.
Thank you. That's amazing.
Good friends.
Thank you so much for being here. Thank you for being a part of this. For all of our sisters out there, now you know you have another friend in Elizabeth, and you definitely have a friend in me. Thank you for tuning in to Diving Deep with Denise. You will have the podcast notes on my website, denisecordero.com, as well as please help to grow this amazing sisterhood. We love to hear from you. Comment, share, like. We'll be on iTunes. We'll be on Spotify, YouTube. Go check us out through all of our channels. Love you. Until next time. Take care.